Hi guys, welcome to BioGenie, a podcast where science meets everyday life. My name is Arya Parekh. I'm an IBPP biology student here to showcase how science isn't just for doctors, lab experts, or journalists. It's for you and your everyday life use. So joining us today is Dr. Toral Matani, a dedicated homeopathy doctor who has been guiding patients with holistic and personalized care. In today's conversation, we'll learn about her journey, uncover common misconceptions, and hear valuable advice for students who aspire to enter this field that has touched millions of lives. So let's begin. Welcome to the podcast. So, firstly, Doctor, what inspired you to choose homeopathy as your career path, and how has your journey shaped the way you practice today?
So my father's family used to follow homeopathy only since probably the last 90 to 100 years. So my father and all his siblings were always given homeopathy only as children. And that obviously followed because my aunt became a homeopath herself. She's very well known in her field, and that's what we've had since childhood. So it was a natural progression that I would also join the field. If I took medicine, it had to be homeopathy.
Interesting.
System of medicine which believes in the law of similars. It means like cures like. Symptoms which healthy individuals give when given the medicine. Later on, the same symptoms in a diseased person is what guides us to the choice of remedy. That's how we treat the patients depending on the signs and symptoms told to us by them. Whereas in modern medicine, as you are saying, the
Yeah.
conventional medicine, in that they go by the diagnosis of the disease. If they do not have a diagnosis, it's difficult for them to treat, not for us, because we
Okay.
follow the signs and symptoms given by the patient.
All right. So, also, could you share a memorable case where homeopathy made a significant difference in a patient's life and it stayed with you personally?
So there was this one case sent to us by a general practitioner. The man was his house help, and he had all the arteries of his leg blocked. He had been advised to amputate his leg above the
Okay.
knee because there was no circulation below.
Okay.
So, on treatment, his circulation started improving. This was a case seen by many doctors before, all the specialists in the field, and they had said there is no choice but to cut off his leg. But the circulation began improving. Later, they said he needs to amputate above the ankle, which they again modified and said maybe below the ankle amputation. And finally, at the end of the treatment, they could not uh, salvage. Only two of his toes had to be cut off. The rest of his leg, he had
So
normal
he was
circulation.
able to recover.
Yes,
Okay.
they recovered significantly, which goes against the conventional medicine
Yeah.
expectations. But
It
that's what
shows how
homeopathy
effective
achieved.
homeopathy is.
Yes.
Yeah. For students aspiring to study or practice homeopathy, what are some of the biggest challenges they should be prepared for, and what key habits or skills will help them succeed?
So, for students aspiring to be homeopaths, one, you need to be a good listener. Other than, of course, a hard worker studying, which is required in almost every
Yeah.
field. But other than that, you have to be patient and you have to be a good listener. And then you have to have an open mind because if you go with a set path that, I will give this medicine, it doesn't work that way. You have to really find the remedy for the
Yeah.
patient in front of you, which differs from patient to patient. We don't go by the name of the disease.
Okay.
So that's all.
I think that will help many listeners also. There are often many misconceptions around homeopathy, with some people doubting its effectiveness. So, how do you address those doubts while speaking to patients or the general public?
So, one misconception that people have is that homeopathy is slow. It is not so. Sometimes the disease is so long standing that the overall cure takes time. They do get relief soon, but again, that varies patient to patient depending on their response to the
Yeah.
medicine. Another misconception is that homeopathy has a placebo effect. It is not so. It's definitely effective, which is seen by responses seen in newborns, in comatose patients. They do not know they are getting medicine, right? And they still show a response. That shows homeopathy is definitely effective.
Awesome.
Reminds me of this case of a 15-year-old girl. She had typhoid encephalitis, that is inflammation in the brain, multiple complications like liver failure, kidney failure. Many doctors who saw her felt that she was soon heading for a coma and she will not ever come out of it. They were only treating her symptomatically until homeopathy was given to her. After a few hours, she was 50% better. Next day, she was 90% better, and she completely recovered. This girl, who was supposed to have gone into a vegetative state and never come out of it, recovered within just 24 to 48 hours on homeopathy. So, and that girl today is a doctor doing very well in her life. And this was really unexpected, according to the doctors of modern medicine.
Wow, that's just so motivating that how she went from a vegetative state to perfection. That's just amazing. Do emotions really affect our physical health the way homeopathy suggests?
Yes, emotions definitely play a big part in our well-being and good health. For example, if you are stressed about something, you get a phone call that your neighbor is met with an accident, you will suddenly experience a lot of turmoil. You may visit the washroom, you may get elevated blood pressure for a short time, you can get into a panic state, all that can happen. So, this is just a small example. Chronic stress, chronic anxiety can definitely lead you down the path to actual disease.
Yeah.
So, emotions, good emotions also can help you overcome it. For
Yeah.
example, there are cancer patients who, because of their strong will, because of their positive attitude, they recover so much easier and better than other patients who may have a negative attitude towards life or towards the disease.
So your behavior affects your health.
Your thoughts, emotions, behavior, everything. Yes.
So listen up, viewers. Don't always get stressed out about things. Just stay happy, stay relaxed, and chill out. Everything will work it out. So, what's one easy health tip that you give to students for juggling stress and studies?
So for students, I think regular study will keep them off the last minute panic, which most of them experience because they're not prepared enough. Also, a good night's sleep, a well balanced diet, maybe a little stroll during their break time from study. They don't have to sit glued to the chair and study for hours on end. They can take short breaks and refresh themselves and come back to the study in a better frame of mind. That's about it. I think most important being good sleep, even on the day of the exam.
It's very helpful. So, quick fun question: coffee, green tea, or the sweet little globules?
Sweet globules for sure.
Yeah. So, thank you, Dr. Toral, for coming with us today, for making science and healing sound so simple and inspiring. And to our listeners, you need to stay curious, balanced, and remember, biology is everywhere, even in the tiniest dose of medicines. Thank you. Thank you again. Bye for now, and see you in the next episode.